The title of my presentation is COVID-19 and Intimate Partner Violence. Is a response creating a crisis? I'm going to use the framework of crisis theory and crisis intervention to help frame my thoughts about the relationship between the current public health crisis and the ongoing challenge of dealing with intimate partner violence. The study of crisis has a relatively long history in psychology and has had a significant impact in how we think about intervention to address a wide range of challenging life situations. From those events and experiences that are limited to an individual or small group of people, to events that affect larger populations. Now, I'm not going to very closely look at the theoretical or empirical issues related to crisis, but rather I'm going to use the notion of crisis to help organize my observations about what is happening right now as we navigate the intersection of COVID-19 and the ongoing problem of intimate partner violence. Particularly helpful to my thoughts are the idea of pre-crisis functioning, crisis as a turning point, crisis is introducing a period of disequilibrium, which is eventually followed by a restoration of equilibrium, and crisis as presenting both danger and opportunity. While crisis intervention is often thought of as a model for clinical practice, I want to consider both how the pandemic is impacting individuals, as well as the importance of the larger social context in understanding the challenges. As I will discuss, the pandemic is impacting the experience of individuals and families. And for some, it's clearly precipitating personal crisis. But in order to make sense of how the current pandemic is and will continue to affect intimate partner violence as a social issue, it's important to look at the broader context. That is, the community and structural factors that produce the context which give rise to violence in intimate relationships and makes this such an intractable problem. And we need to look at how our response to the pandemic will or will not shift that context. I'm going to begin by situating myself a bit in this discussion. I'm an academic who's interested in studying couple relationships and intimate partner violence. I look at how violence impacts power dynamics and relationship satisfaction. I also research the experiences of women who seek help at domestic violence shelters. In addition, I'm a clinician who runs a program and trains psychology and social work students in working with couples with a history of high conflict and violence and who want to work towards an abuse-free relationship. So my comments are going to come both as from the perspective of a researcher as well as from a service provider. And I want to also make a few comments about language. I'm going to be speaking about intimate partner violence, or domestic violence, as I will sometimes refer to it, as a gendered issue. While there are instances in which men are victims, this is not the most common pattern. And we certainly know that violence occurs in all types of relationships, including heterosexual and same-sex relationships. So while I acknowledge the diversity of situations in which violence occurs, the most common pattern involves women as victims and men as those who perpetrate the violence. And that's the language I will be using throughout the presentation. All right, so let's begin by talking about individuals and families and how they're impacted by intimate partner violence. Let's start with situating the pre-crisis state. There has been a lot of research documenting the prevalence of partner violence, including the existence of the problem across locations, cultures, and social classes. Prevalence data certainly speaks to the scope of the problem. Now, while we know that violence can affect any woman, we also know that there are groups of women who are at particular risk, including Indigenous women, newcomers, and women with disabilities, for example. There is also an extensive body of research that documents the consequences of violence on women's physical and mental health. We are very aware that violence does not just negatively impact the direct victim. The negative effects of exposure to violence on children has been well demonstrated, with both the short and long-term effects on children being of considerable concern. And we know that violence has a huge social cost. At a micro level, we know that violence often precipitates a crisis for women. For many, the crisis is embedded in a chronically stressful or traumatic environment. That said, the crisis can be a turning point where women take action to ensure safety for themselves and their children. Further, the period of crisis can be a time of decision-making regarding the future of the relationship. Much attention has been given to the issue of women leaving abusive relationships. It's often assumed that the right course of action is to end the relationship. Research and practice has focused on understanding the decision-making process and how to help women make a decision. This focus on leaving, though, has sometimes been in conflict with women's desire to manage within the relationship. For while they most definitely want the violence to end, they don't always want the relationship to end. And as I will speak about in a few minutes, we've organized our health, social service, and justice systems to try to support women and increase decisions that advance safety. We know that there is variability in how well women cope. While the experience of violence has negative consequences, there are some women for whom protective factors buffer these negative outcomes. Research has identified some factors important in determining the extent to which the outcome is negative. We know, for example, that individual factors like self-esteem and cognitive coping skills are important. There are also interpersonal factors like social support, which impact outcome. And we know that broader community factors like access to services and supports can be important. But as in other crises, the outcome of the crisis precipitated by partner violence varies. For some women, there's a return to a previous level of functioning, including a return to the previous level of risk. For some, the outcome is clearly more negative, characterized by a decrease in well-being and an increase in risk for further violence. And we do know that for some women, the crisis begins a process of growth in which, over time, well-being is enhanced and safety increased. So how does COVID-19 disrupt or interrupt this process? There are a number of ways in which the current pandemic is impacting families. First, we know that social distancing has resulted in increased physical proximity. People are restricted in their movement and are spending much more time in their family home. Many people are cut off from extended family and friend networks. This not only is decreasing their access to support, but it's removing a potentially important protective factor. For many families, this is a time of increased financial stress. There have been many layoffs, increasing unemployment, decreased opportunities for employment, and even for those who are currently employed, there's a fear of job loss, perhaps permanent. All of these have increased a sense of economic insecurity. There have also been dramatic changes to community life. Closures of schools, daycares, and various community organizations have further isolated families and removed a layer of support, both in terms of reducing access to tangible help, but also in terms of reducing opportunities for help seeking. What is going on in families is more private now than ever. And there are new pressures on families. Remote working has blurred the boundary between work and family life. There is pressure to homeschool and keep children occupied. There's greater difficulty accessing basic necessities. For example, more families are feeling the threat of food insecurity. Health and social service providers have reduced or eliminated in-person services and replaced them with remote service delivery. The reliance on technology to deliver limited health and social services is no doubt making it more challenging than ever to access supports. And this is likely being experienced disproportionately by those in high risk and those living in poverty. There has also been a slowdown of court and legal processes, which may be increasing risk for some. So how has this and these many changes impacted families? For the reasons I've just talked about, many have called this a perfect storm for the rise of family violence. While we don't fully know the extent to which this is the case, there certainly is evidence to support concern. In our jurisdiction, as I'm sure in many others, there have been multiple reports of homicides related to domestic violence. Many jurisdictions worldwide are reporting increased domestic violence calls to police and crisis hotlines. The Native Women's Association of Canada recently conducted a survey of 250 Indigenous women and found that 1 in 5 women had experienced physical or psychological violence in the past 3 months. Their survey and subsequent consultations found that women reported greater concern for domestic violence than for concern about the coronavirus. Some domestic violence shelters are reporting being at or beyond capacity and having to turn women away. Others have reported concerns about unprecedented reduction in calls and visits, which has them fearing that women are unable to reach out for help. Let's now consider the crisis from a community or societal level. What is the pre-crisis state? Well, I would argue that intimate partner violence has always struggled to be on the political agenda. While there has been acknowledgement of the problem by well-meaning and committed politicians, certainly at least in our jurisdiction, partner violence has never been a priority for funding. We do have a continuum of funded services that span health, social service, child welfare, and justice systems to try to address the diverse needs of individuals impacted by partner violence. But that said, community-based services have always suffered from chronic underfunding. There have been only minimal increases in funding over the past several decades, despite increases in demands and increases in the complexity of issues confronted by frontline services. Many agencies increasingly rely on fundraising to keep their organizations functioning. The sector is well known for its poor pay for workers, despite high expectations for training and high on-the-job demands. Another chronic problem has been inequitable access to services. In Manitoba, my home province, the majority of the population lives in one urban center located in the south of the province. Women in rural and northern communities and women in Indigenous communities have never had equal access to services and supports. Further, Our focus has tended to be on funding crisis services, with very limited funding for long-term supports that many women require. There's also been, I think, ongoing resistance to situating the problem of partner violence within a broader analysis of structural factors such as gender, poverty, and colonization that creates vulnerability to violence. So there's been limited efforts to address violence as it relates to other problems such as access to affordable housing, daycare, income assistance, and employment. We've not really been seeing a real analysis of issues and how they're affected by race, ability, and gender. In terms of precipitating events, the exploding infection rates and serious health consequences worldwide have created what almost everyone would agree has been a public health crisis. Concerns for safety have led to the reduction, as I spoke of many in-person services and/or a move to providing more limited support through remote contact. We have seen on the positive side the development of online resources and the use of technology to support those who experience violence and those at risk to perpetrate violence. And we've seen the development of new services such as chat lines to try to increase the reach. And we are seeing what we've always seen in this sector, an ongoing and strong commitment of frontline service providers to step up and provide support however possible. We've seen creative approaches to providing services and a shift of activities to address the current most pressing needs. For example, community organizations who are providing food and distributing food, looking to reach out to families to provide them with things like art supplies for children, self-care packages for women, and so on. Shelter services have continued to operate while meeting social distancing requirements. Other essential services like police continue to respond to the problem. And on the positive side, we've seen some support and increased support from government. In Canada, our federal government has announced $26 million in new funding to support women's shelters, with an additional $10 million of funding specifically for shelters on reserve to address the needs of Indigenous women. And we've seen the implementation of programs like wage subsidies that will help community programs maintain their staffing levels. We've also, in a more limited way, seen increased funding from provincial governments. For example, in Ontario, the government announced $2.7 million in funding for community agencies to support victims of domestic violence and violent crime. We've also seen an increase in attention from government and the media to the issue of family violence in general. We've seen more government ministers talking about the issue of family violence and promoting existing services. There have been more news stories and series highlighting the problem of partner violence, including the increased risk for violence that the pandemic is causing. This level of attention from the media is greater than we've seen in the past, even during public awareness campaigns initiated by the sector. The coverage has included the voices of advocates who've been speaking out about the need for a gendered analysis of COVID-19 and the need for policies and programs that address the needs of women more broadly, including the needs of marginalized groups of women. So we've heard cries for increased crisis support for victims, as well as increased access to affordable housing, services to deal with mental health and addiction issues, and programs that address the impact of colonization and racism. So overall, it appears that there's been some positive response, and that generates some hope that the problem of partner violence, not only during this time of the pandemic, but longer term, will be on the public's radar and a part of the political agenda. But while I would like to be hopeful, there's also a growing narrative about the need for economic recovery, which is being used to justify austerity measures by government. Our Premier has begun to make cuts to the public sector and publicly funded institutions like education and Crown Corporation, arguing that government needs to divert funds to healthcare and address the growing deficit, which is fueled by fears of a downgrade in the province's credit rating. The pandemic is providing an opportunity to further an ideology of smaller government. This is likely to be a narrative that will dominate the post-crisis period of COVID. With this as a backdrop, it's not likely that moving forward, a broader gendered analysis of violence will be embraced with policy changes that address enduring social inequities that create a context for violence. And from an even narrower perspective, it's unlikely that we're going to see increased commitment to shore up the continuum of services currently in place to mitigate the effects of violence on women. So what will the post-crisis period look like? Well, to sum up, I think we are in a period of increased risk for partner violence. We know that there are women who are and will experience negative consequences. Perhaps we will hear stories of resilience of some individuals in the face of violence, despite the challenges imposed by COVID. I hope that that's true. The extent and nature to which individual women and families are impacted is going to take time and research to fully assess. I am concerned, though, about the long-term post-crisis state for the system. Despite some positive action to address immediate needs within the sector and an increase in public awareness of the issue, I'm less optimistic that at a community and societal level, we are likely to see the long-term resolution be one of post-crisis growth that invests in change that more fully addresses the needs of women and reduces vulnerability to violence. We may well be in a position where post-crisis we're challenged to even return to the pre-crisis state of an underfunded system that struggles to provide basic crisis services.